Hey everyone, and welcome. We see nurses all the time, but have you ever stopped to think about what guides their every move? It's not just a gut feeling. It's this whole world of principles and philosophy. So today, we're going to pull back the curtain and really dig into the fundamentals, the process, the skills, and the core ideas that define what it actually means to be a nurse. So let's start with the big question. What does a nurse really do? It's so much more than what you see on TV, taking temperatures and giving shots. Nursing is a really complex science, and it's built on this incredible intellectual history and a super systematic way of providing care. So let's just toss out the stereotypes and get to the real deal. All right, here's the official definition from the American Nurses Association. They say nursing is about the protection, promotion, and optimization of health. But check this out. It's also about preventing illness and relieving suffering through advocacy. And notice who they're advocating for. Not just one person, but entire families, communities, and even whole populations. That just completely reframes it, right? It makes nursing this huge society-wide responsibility.
Now, a powerful definition like that doesn't just pop out of nowhere. It's really standing on the shoulders of giants, these incredible pioneering thinkers who literally shaped nursing into the science that it is today. And their theories, they're the why behind every single thing a nurse does. And it pretty much all starts with the legend herself, Florence Nightingale. Her focus was just revolutionary for its time. Way before we really understood germ theory, she knew that a patient's environment was absolutely critical for their recovery. She broke it down into 5 key things: pure air, clean water, good drainage, cleanliness, and light. I know, it sounds like common sense to us now, but back in the 1800s, this was a game changer that saved countless lives.
And this quote just captures her philosophy perfectly. See, she says the nurse's unique role is to assist the individual. It's not about fixing them. It's about creating the best possible conditions so the body can do what it does best, heal itself. It's all about partnership and empowering the patient, whether they're getting better or finding peace at the end of life.
Okay, so if that's the philosophy, how do nurses make it happen for every single patient every single time? Well, they use a blueprint. It's a systematic, problem-solving method that makes sure care is always thorough and effective.
And that blueprint is called the nursing process. It's the structured framework that guides literally all nursing care, and it's universal. It doesn't matter if a nurse is working in a high-tech ICU or a small community clinic, they are using this process. And luckily, there's a handy little acronym to remember the steps: ADPIE.
Let's walk through ADPI, because honestly, this is the engine that drives all of nursing. First up is A for assessment. This is the detective work, gathering all the clues and data. Next is D for diagnosis, where the nurse analyzes all that data to figure out the patient's specific problems. From there, it's P for planning. They create a roadmap with clear goals. Then comes I for implementation. This is where they put that plan into action. But it's not over. The final step, E for evaluation, is where they check to see if the plan is actually working and tweak it if needed. It's a constant loop of problem solving.
Okay, the theory is cool and all, but let's get real. What does this actually look like on the hospital floor? How do nurses use their skills to work through that ADPIE process? Well, it all kicks off with that first, absolutely crucial step.
Assessment is the bedrock. It's all about that detective work. A nurse is using all of their senses. They're observing how a patient is acting, they're listening to their story, they're measuring vital signs. They're basically gathering clues from everywhere, both from what the patient tells them and what their body is telling them.
And this chart is a perfect example of how raw data turns into useful information. So a nurse doesn't just see a blood pressure of, say, 145/95 and write it down. They use a standard chart like this one to figure out what that number means. In this case, it would tell them the patient has stage 1 hypertension. Suddenly, that one piece of data has a clear clinical meaning and starts pointing them toward a diagnosis.
But assessment isn't just about the numbers you can measure with a machine. It's also about what the patient is feeling, their subjective experience. And pain is the perfect example. Using tools like these pain scales, the one with the numbers or the one with the faces, a nurse can actually put a number on something that's totally invisible. And it's considered so important that it's often called the 5th vital sign, right up there with temperature, pulse, and blood pressure.
But think about it. How do you accurately assess something like pain? You can't just plug someone into a machine. The whole thing hinges on one master skill: expert communication. The way a nurse asks the questions, and maybe even more importantly, the way they listen to the answers, is what turns a vague feeling into critical data.
And communication is definitely a two-way street. You've got the verbal stuff, the actual words being said. But just as important, if not more so, is the nonverbal. A patient's posture, the look on their face, their tone of voice. Sometimes, those things tell a nurse way more than words ever could. A great nurse is an expert at reading both.
So we've looked at the philosophy, the process, and some of the key skills. And when you start to put all those pieces together, you realize that being a nurse means wearing a lot of different hats, sometimes all at the exact same time.
I mean, seriously, a nurse is never just one thing. In a single shift, they're a hands-on caregiver, a top-notch communicator, a teacher for patients and families, and a fierce client advocate. But they're also a counselor, a leader, a manager, and even a researcher. Each one is a full-time job in itself, and they have to be all of them at once. It's got to be one of the most multifaceted jobs on the planet.
You know, from Florence Nightingale focusing on clean air all the way to the complex, tech-heavy roles of today, nursing has never, ever stopped evolving. It's constantly adapting to new research, new technology, and what society needs. And that just leaves us with one final big question. As healthcare continues to change at lightning speed, what will the nurse of the future even look like?